Welcome to Damal Consult Career Academy. In today's video, we're diving deep into the top community health worker interview questions and answers you need to know to pass your interview confidently in 2025. Whether you're a fresh graduate or looking to switch careers, it'll guide you through practical tips, sample answers, and strategies that will help you stand out and secure that job. Make sure to watch till the end because it'll also share bonus advice on how to prepare and impress your interviewers. Let's get started. 1. Can you tell us about your experience working with underserved or vulnerable populations? Yes, I have had meaningful experience working with underserved and vulnerable populations. Through my previous role as a volunteer health outreach assistant in a community clinic, I worked closely with individuals facing socioeconomic challenges, including migrants, the elderly, and low-income families. My responsibilities included providing health education, assisting with appointment scheduling, and connecting clients to local support services like food banks and housing assistance. I learned the importance of empathy, active listening, and cultural sensitivity. I also developed strong communication skills that helped me build trust with individuals who were initially hesitant to engage. This experience deepened my commitment to health equity and inspired me to pursue a career as a community health worker, to continue serving those most in need. 2. How do you build trust with the community members you serve? Building trust with community members starts with showing genuine respect and empathy. I take time to actively listen to their concerns without judgment and make sure they feel heard and valued. I also ensure confidentiality and follow through on any commitments I make. Being consistent, transparent, and culturally sensitive is key. For example, in my previous role, I made it a point to regularly visit community members, learn about their background and preferences, and connect them with the right resources. Over time, these small actions helped me build strong, lasting relationships based on trust and mutual respect. 3. What do you think are the most important qualities of a successful community health worker? I believe the most important qualities of a successful community health worker are empathy, strong communication skills, cultural sensitivity, and reliability. Empathy helps me connect with clients and understand their challenges without judgment. Communication is key because I often explain complex health information in a way that's easy to understand. Cultural sensitivity ensures I respect different backgrounds and traditions, which helps build trust. Lastly, reliability and consistency are crucial. Clients need to know they can count on me. These qualities allow me to serve the community effectively and build lasting relationships that promote better health outcomes. Before we proceed further in this video, I want to quickly share something important that can really help you prepare for your interview. If you're aiming to succeed as a community health worker, I've put together an ebook titled 50 Community Health Worker Interview Questions and Answers designed to give you the confidence and knowledge to ace your interview with ease. This ebook is very affordable, and right now, there's a special 70% discount going on. So, it's the perfect time to grab your copy. Get it today for 70% off. For this week only, the first 20 people to download will get the ebook at an exclusive 70% discount. To download, simply click the Sealer or Fourth Wall link in the description box below this video. You can also visit Sealer Co directly using the link provided, or click on the Fourth Wall link to order instantly. If you have any questions or need more information, don't hesitate to chat with our friendly online customer care representative on WhatsApp or send us an email. We're here to help you every step of the way. Don't miss out on this opportunity to boost your interview skills and stand out from the crowd. Get your copy today and take a confident step toward your dream community health worker job. 4. How would you handle a situation where a client refuses help or is hesitant to receive services? If a client refuses help or is hesitant to receive services, I would first take the time to listen carefully and try to understand their concerns without judgment. It's important to respect their autonomy and build trust. I would gently explain the benefits of the services, provide clear information, and answer any questions they may have. If appropriate, I might share success stories from others in similar situations to help them feel more comfortable. My goal is to empower the client with knowledge so they can make informed decisions at their own pace. It also let them know that support is always available when they're ready. 5. Can you describe a time when you had to advocate for a client's needs within the healthcare system? Yes. In my previous role as a community health worker, I supported an elderly client who had been discharged from the hospital without a clear follow-up care plan. She was confused about her medications and didn't have transportation to attend her next appointment. I first contacted her primary care provider to clarify her treatment plan and ensure she had proper instructions. I also coordinated with the local transportation service to arrange rides to her upcoming appointments, and connected her with the home health nurse for weekly check-ins. By taking these steps, I ensured she received the support she needed to safely manage her recovery at home. This experience reinforced the importance of being a strong advocate to bridge the gap between healthcare services and the client's real-life challenges. 6. How do you stay informed about local resources, programs, and services available to the community? I stay informed by actively networking with local healthcare providers, social services, and community organizations. I regularly attend community meetings, health fairs, and professional development workshops to learn about new or updated programs. I also subscribe to newsletters, follow relevant local government and nonprofit websites, and maintain a resource database that I update frequently. This helps me provide timely and accurate information to clients and ensures I'm connecting them to the most appropriate support available. 7. How would you handle a situation where you suspected abuse or neglect? If I suspected abuse or neglect, I would handle the situation with urgency, sensitivity, and in full compliance with safeguarding procedures. My first step would be to remain calm and ensure the immediate safety of the individual, especially if they are in danger. I would document all observations carefully, sticking to facts without making assumptions, and note any physical signs, behavioral changes, or statements that raise concern. Next, I would report the issue promptly to my supervisor or the designated safeguarding officer in my organization, following internal protocols. If necessary, and particularly if the individual is a child, elderly person, or vulnerable adult, I would escalate the matter to the appropriate external authority, such as Child Protective Services or Adult Social Care. Throughout the process, I would ensure confidentiality is maintained, sharing information only with those directly involved in managing the case. I also understand the importance of offering support without judgment, listening empathetically if the individual opens up, and reassuring them that help is available. As a community health worker, it's my duty to be a trusted advocate and a link between the community and the services that can protect and support them. 8. What strategies do you use to educate clients about health and wellness in a culturally sensitive way? To educate clients about health and wellness in a culturally sensitive way, I start by learning about the cultural backgrounds, values, and beliefs of the communities I serve. I avoid assumptions and instead listen actively to understand each person's perspective. I also use simple, clear language and visuals that are appropriate and respectful to their culture. Whenever possible, I involve community leaders or use translated materials to ensure the message is accessible. Most importantly, I tailor my approach to each individual, showing empathy and respect, so they feel heard and empowered to make informed decisions about their health. 9. How do you manage your time and prioritize tasks when supporting multiple clients? Managing time efficiently and prioritizing tasks is crucial in the role of a community health worker, especially when supporting multiple clients with diverse needs. To do this effectively, I begin each day by reviewing my client list and identifying those who require urgent attention, whether due to medical emergencies, upcoming appointments, or critical social needs. I prioritize these cases to ensure that immediate concerns are addressed promptly. I use organizational tools such as calendars, task management apps, and detailed to-do lists to map out my daily and weekly tasks. This helps me allocate sufficient time to each client and prevents any important follow-ups from being missed. I also set clear, achievable goals for the day, which helps maintain focus and productivity. Flexibility is key in this role because client needs can change rapidly. I maintain open and regular communication with clients and other healthcare professionals to stay updated on any changes. This allows me to adjust my priorities accordingly and provide the best support possible. Lastly, I make sure to balance my workload to avoid burnout by taking short breaks and managing stress, so that I can consistently deliver compassionate and effective care to every client. Overall, my approach combines careful planning, adaptability, and strong communication to manage multiple responsibilities successfully. 10. Why do you want to work as a community health worker, and what motivates you in this role? I want to work as a community health worker because I'm deeply committed to improving the health and well-being of underserved and vulnerable populations. I believe that everyone deserves access to quality healthcare and the support needed to live healthier lives. But unfortunately, many people face barriers such as lack of information, limited resources, or mistrust of the healthcare system. As a community health worker, I have the unique opportunity to act as a trusted link between the community and healthcare providers, helping to break down these barriers. What motivates me most in this role is the ability to empower individuals and families by providing education, resources, and emotional support that can lead to lasting positive changes in their lives. I am inspired by the resilience I see in communities and by the knowledge that my work can directly contribute to improving health outcomes, reducing disparities, and building stronger, healthier communities. This sense of purpose drives me to approach my work with compassion, patience, and dedication every day. Do you have any question for us? Yes, thank you for asking. I do have a few questions. Can you tell me more about the team I would be working with? And how the community health worker role collaborates with other healthcare professionals here? What are the main challenges your community faces currently, and how does this role contribute to addressing them? Are there opportunities for professional development or additional training to help me grow in this position? How do you measure success or impact for your community health workers? Lastly, what are the next steps in the hiring process and the expected timeline for making a decision? Thanks for watching. I hope these community health worker interview questions and answers have boosted your confidence and given you the tools to succeed in your 2025 interview. Remember, preparation is key. Practice your answers, stay calm, and show your passion for making a difference in the community. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell. For more career tips from Damal, consult Career Academy. Good luck, and I'll see you in the next video.